Hi guys, welcome to Vita-Plug Academy. Today we have some really interesting information that I want to share with you. Today we're going to actually see what the drain looks like from the inside, and I'm going to show you the mechanics of how the drain functions so that you can better understand why it's so important that we take care of them. We have a lot going on here today. We have Gloria in the back chefing it up, and I have all my educational material ready to show you how this works. So you're gonna chop all this up, right? Okay. Okay, so let's get started. I've brought for you today, this is exactly what you'll see in the OR. This is what's called a bulb reservoir. It's the round grenade-looking portion that you see on your tummy tuck drains. And here we have a perforated flat drain. This is actually the little tube that we refer to as this straw that kind of sucks the fluid out from underneath your skin. This is the piece that lays flat against the abdomen before your incision is stitched up. So what I'm going to do is open these up for you. I don't have gloves on, which in the OR obviously we would have gloves on. This is just for demonstration purposes. So they come in these little bags. So here's what your drain looks like. As you could see, it's labeled 25, 50, 75, 100 cc's so that we could monitor how much blood is actually being removed from underneath the skin and accumulated. Then here is our perforated flat drain. And this is what this looks like. As you see here, this is a flexible silicone-like material, and it has very little holes all around that are actually where the fluid is going to enter through. So in the OR, and we're going to try to get some live video footage from the OR to show you exactly what this looks like. But we're going to pretend that this is your abdomen. So what happens is this is laid across the incision, and this bulb is connected to this tube. So I have a glass of cranberry juice here that we're going to use as a representation of fluid that starts to accumulate underneath your skin. Okay. So as you see, while the ball is not on suction, there's no action taking place here. There's no movement. But because this bulb works off of negative pressure, I'm going to squeeze the air out of it, and I'm going to recap. Oh, it didn't work that time. Okay, so we had to make a few adjustments to make it a little bit more realistic. The drain was not able to lay as flat as it would inside your abdomen, so I had to put a little tape in this corner to make it work and to fully saturate the tubing that we have here. So as you could see, the flat part that we were saying that has the little holes, it's fully submerged in the fluid. This is what takes place inside of your body. As your body starts to accumulate fluid, that's when you'll start to notice swelling. I'm going to show you now why it's so important that we maintain these drains and make sure that we always keep them on proper suction. As you could see, you have a belly full of fluid here, and you have a bulb that's full of air. There's clearly no movement taking place through this. There's no suction. So this is just starting to build up, and it will continue to build up as your body responds to the trauma from the tummy tuck. So what we're going to need to do is uncap here, as Gloria showed you in the last video. Now we have it on suction. We're removing the air, and we're going to recap it. Now as this starts to expand, you see how it works like a straw. It's going to pull that fluid out. See, it's just filling up. So as this works off of negative suction, it's going to continue to expand and continue to remove all the fluid that's accumulating there. Okay, so wow, this is really filling up fast. So you can imagine what's taking place inside your body. Now, what are some problems that would arise that would make this drain stop working? One of the most common that we'll find is blood clotting. Now, this is just a simulation, it's only cranberry juice, but if this was your blood, our blood starts to become thicker as it starts to pass through this tube. And as it's sitting there, you'll start to find clots. So if this was pinched like this, you'll see it's going to stop running. So what do we do to fix that?
Okay, so what we're going to be doing today is going to be draining the JP drain that comes usually with the tummy tucks. So the first thing you want to do is, I like to use the hand sanitizer because it serves also as a way to clean the actual drain. And I lube up the drain itself first, just so that it provides a little bit of slippery. I don't know. All right, and then I get a little bit more. What I'll do is right at the insertion point, I will hold on using the tip of my finger, the pad of my index finger, and my nail from my thumb. And then with the same technique on the other hand, I will pop this open to not fight against me. And I will hold on as I milk this down. So this is what's called milking the drain. And then you let go at the top, again, hold, and continue to slide down. Let go, and continue. So in the case that there's a clot here towards the actual insertion site, you place a warm cloth right over that insertion site to try to loosen things up a little bit. And I'll just leave that there while I work on the other drain.
Okay, so I'm going to show you guys what I do to make sure that I properly preserve the function of this drain by making sure that there's no clots taking place. Now, it is so imperative before you get started with milking the drain that you recognize this is only held in by a very small stitch, and the rest of this is following behind underneath the incision. So you have to make sure that you grip this very tightly before you start to work this drain and try to work out any clotting that's taking place in this drain. So what I do is I use Purell, or any type of hand sanitizer works. I like it because it's antibacterial. I wet my fingers on this hand with the Purell so it gives me something slippery to work with. So while I am again squeezing pretty much like to the point that my hand is shaking right now, that's how important it is that I don't let this go. I'm gonna hold with one hand and I'm gonna pull and strip that drain. Now, as I get to this point, you see I'm squeezing and I'm pinching. I'm gonna work my way up and I'm gonna hold here again, making sure that there is never any tension felt on this incision line. The reason why this is so important is that it's just a tiny little stitch. And if I were to put any unnecessary pressure on this, I could very easily break that stitch and pull out and dislodge this entire drain, which would cause no escape for all of this fluid that is accumulating inside the abdomen. What would happen next? The patient would most likely need to go back to her doctor or her PCP, and he would have to manually extract all this fluid with a needle, which is not fun, it doesn't feel good, and it's very time consuming. We could go on and on. Just remember, do not let go when you're trying to milk this drain. So I'm gonna continue to milk the drain all the way down, redirecting all the fluid or any clots through this line. Pulling, pulling, pulling. Sometimes you'll get little hard spots. That's okay. You just make sure you're anchoring with this hand and you're working through that clot with the other. Continue to pull and kind of strip that line. And as you do that, it's not really showing here because again, this is just a simulation, but you're gonna notice it's gonna start sucking the fluid. You'll see more fluid coming, and sometimes it'll even make like a straw sound, like somebody's sucking on the straw at the end of their drink. Okay, so now I've redirected everything into my bulb, and you see it's full again. So what I'm gonna do, open it up, empty out that fluid. And recap again, most important, I'm compressing with this hand. So as it starts to expand, there you go, it's taking out more fluid. And that pretty much explains our drains. So it's still draining. So all this fluid will be gone in no time. And that's pretty much why it's so important that you guys know how to properly take care of these drains. I'm glad we could be of assistance, and give us a call with all of your nursing needs.